Dr. Deborah Peinels, a psychiatrist who has worked with people with serious mental illness and intellectual and developmental disabilities throughout my career. I am a senior medical and forensic advisor at the National Association of State Mental Health Program Directors, a consultant to the National Association of Directors of Developmental Disability Services, and adjunct clinical professor of psychiatry at the University of Michigan Medical School. This module will discuss best practices for developing and implementing a person-centered treatment plan that includes psychopharmacology, including approaches for complex populations such as those with communication challenges and those who may be nonverbal. Person-centered care is defined by the World Health Organization as empowering people to take charge of their own health rather than being passive recipients of services. It is with this in mind that treatment that focuses on an individual's goals and preferences and empowers them to collaborate with their own providers on their own care plans comes to mind. 4 person-centered care principles from North Star, Oregon have been identified. Treat people with dignity, compassion, and respect. This can be overlooked when working with people with IDD. As we're all in a hurry in our busy clinical day, we want to make sure that we take the time to treat people with that dignity, compassion, and respect. It can be achieved through understanding what is important to the individual and helping them identify and achieve their own goals. Provide coordinated care, support, and treatment, which involves every person on an individual's care team. Remember, people with IDD and other cognitive challenges may have additional supports in their sphere that need to be brought in to the treatment planning. Offer personalized care, support, and treatment. Each individual is different, so approaches must be modified to the unique needs of the individual. Enable people to recognize and develop their strengths and abilities for an independent and fulfilling life. Individuals in the provider's care must be involved in the decision-making process because it helps them understand themselves better and become more independent. Even if there are support professionals around them, it's important that they be involved in their own decision-making. We should expect appointments to take longer because we are not only talking to the individual with IDD, but we may be talking to family members, direct support professionals, or others that they bring with them into care. Person-centered treatment planning can improve the outcomes and community participation in individuals with IDD. Facilitators of person-centered planning include having a good relationship with the individual and developing effective communication strategies. Listening is essential in developing a person-centered plan and collaborative approaches between individuals and providers. This will involve listening to how the person is feeling, eliciting information about any symptoms, such as mood symptoms or psychotic symptoms. It is important to think about how the individual that is describing things, if they're talking about recent losses or recent upsetting events. They may describe things that are scary, that may point to feeling threatened or even paranoid, or they may sound confused about voices they hear. These are important indicators for what may be going on for them in terms of any co-occurring mental illness. Any of those types of details may lead the prescriber to understand target symptoms for treatment based on the person's perspectives. It is important to equip the individual with all the relevant information they need to make informed decisions, including information about medication. Use simple language to describe the most common and the most serious potential side effects, as well as the potential benefits of the treatment. In working with individuals with IDD with communication challenges, remember that there can be visual aids, repetition, and empathy in addressing the individual directly to be most helpful. It may be helpful, for example, to show the individual pictures of the pills that will be prescribed, allowing opportunities for questions that they may have. It is important to build rapport with that individual, beginning the visit with explaining the purpose and establishing communication preferences. Persons may require the use of assistive communication devices or even interpreters. Practice triadic communication, speaking to the individual first and using the caregiver or the interpreter to help facilitate communication, but not as a replacement. It is important that the practitioner work with the patient directly. Provide patients and caregivers with appropriate materials about the medications being prescribed. Consider using adapted literature that uses visual aids, pictures, and other techniques written at an elementary reading level so that the individual understands the medications to the best of their ability. In this module, we have reviewed some of the techniques for person-centered treatment planning for psychopharmacological practices in individuals with IDD and other cognitive challenges. In Module 4, we'll talk about prescribing and monitoring for side effects and adherence.